Greetings, my fellow YouTube nurses. Where have you guys been? I've been here. I have not gone anywhere, okay? Let's talk about, first and foremost, thank you for subscribing, following, and hitting that like button. Thank you for following on Instagram and also on Twitter. Like I said, it's Nursemendoza. Follow it, hit that like button. So let's talk about the random question of the week. That was basically the one most important question that stood out. And by the way, you are the winner of the stethoscope. I will pass that out. I will send the link and all that description a little later. But first, let's talk about the one that stood out and actually caught my attention. On Instagram, you guys put down questions about med-surg tele, the grad career paths when you guys graduate, so many different questions, right? But the one that stood out the most was what floor, what unit, what specialty area as a nurse can I be ready for, and if I'm ready actually to do, the position. I like that question. That one stood out the most because when I first started, I wanted to go in so many different areas. I was like, yeah, ER. Yeah, I want to go ahead and go to tele. Oh man, I want to go into ICU. And I was just all over the place because I didn't know where I wanted to go. But I'm going to tell you right now, as any nurse should, they should definitely go into specialty unit or ICU unit. Critical care, that's the most important way to go. I mean, you're learning about everything. And it's not just an ABG randomly, you go here and there, not a random blood test. I mean, you're doing the whole work for the patient. Yeah, they call them vegetables in the ICU, but we're there to get them better. They come in for a diagnostic or a diagnosis for, I don't know, they're septic. They may go into shock. Blood pressure's low, heart rate is high, they're febrile, you get some blood cultures. You also listen to the respiratory, they're going to be a little coarse, maybe send a sputum culture. They're going to be intubated just to keep them safe so they don't get worse, especially with antibiotics you're going to give them. They're going to be on pressure control, go down to pressure support, and then by the time they're alert, oriented, take them off sedation, they're WBCs and everything's dropped, their infection's getting better, they're afebrile, their pressure's fine, temperature's great, their urine output has increased, and also all the good stuff starts piecing together like a awesome, cool detective type of nursing work. It's pretty cool. And so when you put all the pieces together, patient gets extubated, boom. Then they go to, I don't know, another floor, rehab, whatever their case or scenario is. It's kind of nice. So you're following through with protocols like SIRS protocol. You're following through for any type of protocol that the hospital may have. And it's nice. In the ICU, that's the way it goes. You follow it. Plus, you have great people to work with. And you're actually just doing your work. You're helping everyone there on the same floor. You're asking questions. But as an ICU nurse or CVICU, whatever specialty, I would say critical care is the most important way to go. You just learn so much on that floor. And there's days, of course, you're going to get days where you pull your hair. There's going to get days where you're just hectic. You start having premature ventricular contractions. Your cardiac output is all over the place. It's just crazy, but you learn so much in the ICU. And that's where anybody should go as a new grad or get some experience in the tele, med-surg. Go on any department that you may think may fit you. Med-surg tele may be the best place to go, ER. But if you really want to sit there and learn as much as you can, I would definitely recommend ICU. I love it. But that question just stood out so much for me. It got me on board with thinking about how I started. Because I went into so many different areas. But the ICU, CVICU was kind of my favorite position. I just love how you're there with that patient or two patients in there. You get them extubated, you get them down to a different floor, rehab, they get discharged, they go home, boom, they're much better. But you learn so much as holistic care, and you start being a detective with the doctor, doing the blood work, diagnostics, x-rays. The reason why they got admitted, and you put all the pieces together, collaborate with the team, the docs, and how everything works, and you start following the protocol for the hospital, and you start learning, and you start making recommendations. It's really, really nice. I recommend anybody go into critical care. Like I said before, I was just giving examples, but that one stood out the most. I would definitely do that, guys. Now, that's my opinion. So if you guys want to go into different specialties or units that may float your boat, check it out. Never hurts to try something new. Keep learning. Nursing is expanding every single day. Before I head out, my fellow YouTube nurses, I want you guys to check out the Dissector of Death. Yes, I said it, and I'll say it again. The Dissector of Death. Now, she's been doing Instagram for a minute now. She's got well over 300,000 subscribers. She's amazing. I follow her. She's actually a surgical pathologist assistant. She deals with surgical specimens, the stuff that we don't see as nurses, okay? And she is awesome. Her name is Nicole Angemi. I would definitely check her out. Follow her on Instagram. Her YouTube channel just started. Scope her out. Okay, I'm gonna put the link on the bottom. You won't be disappointed. She actually has been doing it for a minute now. When I say a minute, I mean for a while. And all the pictures, I've been intrigued. There's some that we don't really see on a day-to-day basis, and her channel has been pretty amazing. I like it, and I just want to share that with my fellow YouTube nurses. So don't forget to subscribe, like, and go ahead and follow her too. Her YouTube channel is Mrs. Angemi, and I'll put the link on the bottom. It's MRS period ANGEMI. Follow her, it's amazing. Her Instagram is also Mrs. Angemi, but it's a little different. It's MRS underscore ANGEMI. I know. Check it out, scope it out. You won't be disappointed. My fellow YouTube nurses, peace.